Many of cardiologists are familiar with contrast study. We use agitated saline to contrast right heart in order to discover any shunt between left and right heart. In this movie, passage of some contrast bubbles through intra-atrial septum is illustrated. As a matter of fact, there is a spontaneous echo contrast in heart without contrast media injection. A spontaneous echo contrast in left or right heart is a swirling haziness and is due to blood stasis. It is named smoke-like spontaneous echo contrast, which is mostly seen in dilated left atrium and mitral stenosis. It is secondary to blood stasis and is related to thromboembolic event. But there is a non-smoke spontaneous echo contrast as well, which is as a snowstorm and usually related to Valsalva maneuver. It is due to transient stasis in pulmonary circulation. Non-smoke spontaneous echo contrast can be seen in inferior vena cava too. We usually inject fluid containing microbubbles as a contrast media in patient's vein to discover patent thrombal oil and ask patients to make Valsalva maneuver. In this time, we should be aware of concomitant making non-smoke spontaneous echo contrast in pulmonary circulation, which makes a snowstorm in left atrium. Indeed, it is not a passage of contrast across the septum, and we shouldn't misdiagnose it as a patent from an oval. It is a normal non-smoke spontaneous echo contrast. To sum up, there is three types of contrast in echocardiography. Contrast media we inject in heart, and a spontaneous echo contrast, which includes a smoky contrast which has hazard of thrombus formation, and a normal non-smoky spontaneous echo contrast.